time will come when every newborn will do a genetic screen at birth, and then we'll also have a genetic screen 30 years later. So from preventive healthcare, we are moving to personalized healthcare.
Okay.
And this whole advent of genomics and genetic testing, according to me, is going to revolutionize the way in which healthcare is going to be practiced.
On social media, the youth gets criticized because they don't want to hustle just to make a name or to make a brand. They want to actually hustle because they want to meet their lifestyle needs.
Find a purpose that you are happy to remain committed to. Even a venture capital fund, right, has a lifespan of 10 years. That means they allow businesses to incubate and ramp up over a 10-year period. So give yourselves that time. Don't be in a hurry. So it's very important when you start a business, what are you trying to solve?
Hi everyone, welcome to Squeeze Sessions with Galgal. Today we have Dr. Sanjay Arora with us. Sanjay Arora is the founder of Suburban Diagnostics. Suburban Diagnostics started in 1994 with one pathology lab. And today they have over 250 centers across the country. It's one of the country's leading medical brands. And recently, Mr. Arora sold his company for 925 crores. And now he's spearheading his family office, Suburban Ventures. Hello, doctor. How are you?
Hi, Darshan. Thank you for inviting me.
Welcome to the podcast.
Thank you.
So, where do you want to kickstart this podcast with?
So, would you please introduce your journey in a nutshell?
I think Darshan just did that. So I don't like the word sold the company. That's something which I'm a little. See, when you build a brand, right, when you build an organization, you never think that you will eventually have to sell it. So that's one of my sort of learnings, and maybe we'll discuss it over the discussion. I'm a doctor and a medical professional at heart, turned into an entrepreneur, and now I'm looking into a new journey of being an investor. So it's been different pivots in my life, but I still, from my heart, I still think like a doctor, and I guess that's the way. Probably it's helped me remain grounded and connect with people. So that is my journey in a nutshell, I would say.
So, for you to build that brand, Suburban Diagnostics, there's so many variables that could have gone wrong, but you managed to soldier through all those difficult moments over the course of years, no matter what the market situation was, no matter how the industry grew. If you had to label a few principles that you had to stick by, whether it was 1994 or it's 2024, what would those principles be?
Those principles remain. I have what I call is my circle of success, and it starts with what I call is inspiration.
Okay.
What is it that makes you want to get out of bed every day in the morning? So there has to be something that motivates you, inspires you, pushes you, say, okay, I'm looking forward to going to work every day. And I was telling this to my daughter the other day. I said, whatever you do, make sure you look forward to doing it every day. I think that is very important. So when you have that inspiration, you get to work every day. But I've realized that nothing comes easy in life. So you have to work hard at it. What I call is perspiration. So inspiration has to be followed by perspiration. And many times you find that even if you work hard, things don't come easy. So you have to remain committed no matter what. If you believe in what you're doing, if you are excited about it, then you don't give up. So dedication is very important. So you start with inspiration, perspiration, dedication. But as the world is evolving today, right? I mean, you can't remain on the same course. You have to keep evolving. Things are changing. You have software updates that happen every few weeks.
Yeah.
Gadgets change every few months. AI is making life different. So you have to keep evolving. So innovation is a very important aspect of it. So you start with inspiration, perspiration, dedication, innovation, and you realize today is a connected world. So if you collaborate, you can do a lot more than you think you can do by yourself. So I have this line which says that no one is as good as all of us are. So collaboration is very important.
Yeah.
When you do collaboration, you will get some opportunities of celebration.
Yeah.
And every celebration eventually leads to a fresh cycle of inspiration. So this is a virtual cycle that I have formed Inspiration, perspiration, dedication, innovation, collaboration, celebration. Again, going back to fresh cycle of inspiration. And I think that continues to remain relevant even in today's day and age.
No, it's beautiful. I mean, like looking at it from biological terms, like every organ can be like in isolation, it has its own function. But when it comes together, it forms a body, it forms life. So I feel to give life to any business or to give life to your own life, you need to have these sort of principles that can, like, guide you, like, in times of difficulty. And I think you put it across in a very beautiful way. Did you develop this philosophy at the start, or was this something that happened like while you were on this journey? Like, did you always have this clear thinking mindset?
Absolutely not. No, I think this happened over a period of time. I think when you reflect back is when you think that, what is it that worked for you and what is it that did not. So the first time I was invited to give a talk, this may have been 15 years ago, is when I was thinking back and looking at that, what are the things that worked for me? And that's how I came with these, small adjectives. Uh, but yeah, it's a it's a combination of sticking to your task and then looking back and reflecting, and that's when you think that, okay, these are the things that worked. And when I started Suburban, right, so I had to reach every morning to open the shutter myself because there was nobody else, and I kept opening and closing the shutter for a long period of time. Over time I realized that there are certain lessons that I'm learning continue to hold me in good stead even today, which I would call the fundamentals of my journey, which have remained consistent no matter what. I had the keys of the shutter in my hand. So that is great sense of ownership and pride because you own something, right? But with that comes accountability as well. So accountability is not something that is given. Accountability is something that you take on yourself. People say, right, how do you make people accountable? A lot of time you have to take the accountability. Second was punctuality. If I don't reach at 6:30 in the morning, nothing will happen on time. So I have to make sure that no matter what, I reach on time. We had a time given for the podcast. It's better to reach 5-10 minutes before rather than coming 10 minutes later.
Late.
Even if it's an online meeting today, meeting starts at 11, I'll log in at 10:55 and just put my camera off. People should know that I'm already there. Third is humility. Because to open a shutter, you have to first bend down. So every day you are starting by bending down to something that is bigger than you in life. The shutter does not know what you did the previous day, how many patients you saw, how much money you deposited in the bank, how many good cases you diagnosed, how many doctors were appreciating your reports. Shutter does not give a damn. Shutter says, you want to open, first bend down in front of me. So it makes you humble, it keeps your feet on the ground.
Yeah.
And that has remained with me today, that no matter what, don't let anything get to your head. You are not bigger than anything. You are still a piece of the puzzle. So remain humble, keep your feet on the ground. The next is good health. That to open a shutter, you need to have a strong back, you need to have strong shoulders. So to look after anything else, first look after yourself. Only then will you be able to do it consistently over a period of time. The next is maintenance. I'm dependent on that shutter. If the shutter is well maintained, well oiled, much easier to open that than if a shutter is not maintained.
Yeah.
So look after the things that you are dependent on, whether it is your house, your car, your laptop, whatever it is. So maintain the things that you are dependent on. Teamwork and collaboration. That if I came at 6:30, I cannot do everything. So Dashrath, who used to sweep the floor, will come at 6:45. Sharad, my first technician, will come at 7. And then the next person will come at 7:15. And then the lab is ready at 7:30. So teamwork and collaboration. It taught me about having a backup plan. That no matter what happens, work cannot stop. So for some reason, if I'm not able to reach at 6:30, if I'm not well, if I'm on a vacation, just because I am not there doesn't mean the shutter will not open. So how do you have a backup plan no matter what? So who else can have the keys that you trust? Who else can be there at 6:30 in the morning to open the shutter? Who else is there at 8:30 at night to pull the shutter down? So no matter what, you can't do everything. Have a team and have a backup plan. And last but not the least is communication. This is, I'm talking about the days before internet, before phones. So when I pull the shutter down, what can I do to remain relevant? So I would paint the shutter a nice bright color and I would put my residence landline number in the middle.
Okay.
So that because we are essential service in that sense.
Yeah.
So even after the shutter is down, if somebody wanted to reach out to me,
Yeah.
the attractive color would get them there.
Yeah.
There was light on that, and then only my number.
Yeah.
So if they came at 9 o'clock at night and they had something,
Yeah.
they would just pick up they would call on my landline number. So communication, marketing
Yeah.
is what I learned.
Yeah.
So just by opening a shutter, it opened the shutter of my mind to so many different things. And I continue to use those even today in everything that I practice.
Beautiful, sir. Amazing. Now, whenever I look at a shutter, also I'm going to like remember Doc always, like what the principles.
These are the principles you live by,
Absolutely.
and you've been consistent
Absolutely. Yes,
at it.
yes.
Yeah.
By all means.
Thank you for sharing this. Really. Yeah.
You know, what's the beautiful thing about this, Doc? It's that you don't have to. I mean, if you want to like have like an enlightening moment, like in an ashram or somewhere, and like figure that out, that's great. It's beautiful. But people can seek inspiration from anything. Like, you can look at as a simple object as a shutter. It's a very essential object, but it's just a shutter. Like a lot of people walk past a shutter and they might not even notice it. But you have derived so many essential functions of life from it.
Oh yes. It's how we look at it.
Yeah.
That's it. It's all there. Everything is inspiring.
So talking about your business, right? Like you said, you're a doctor. So what was the core idea behind Suburban when you just started off? What was the spark that led to this venture?
Right.
Yeah.
The spark for anything in life for me is excellence. Whatever you do it well or then don't do it at all. For me, it's all or none. There's no half-hearted approach. So even if I have to come to chat with both of you, I have to make sure that I do it really well or then I don't do it at all. It's the clothes that I wear or, it's the cooking that I do at home and I have to invite you on that soon.
Yeah.
I make sure I do it well. And that is what the philosophy is there with everything in my life. So when we set up Suburban Diagnostics, the idea was, and this is more than 30 years ago, so the diagnostic industry was still evolving, I would say, and most diagnostic lab services were largely in hospitals. Privately, there were not so many. I thought that if I set up a diagnostic lab, can it truly be world class? Can it truly be something which can be compared with anything in the West? And that is the objective with which we started. And the tagline that we put up at that time was creating higher standards in healthcare.
Okay.
That was the objective, that what can we do to continue to pushing the boundaries and creating higher standards. And I would like to believe that in some way over the last 30 years, we have lifted the level of diagnostic standards, not just in Suburban, but across the industry, because you push each other, right?
Yeah.
And overall, I think the standards of diagnostic services have significantly improved across the industry over the last 30 years. That for me is perhaps the most satisfying outcome of creating higher standards in healthcare.
But doctor, now going back to early days when you decided this idea came to your mind and you wanted to compete with the hospitals, did you find it difficult at the start to compete with these players who are established in the market? They have probably more resources when compared to you at that time. Was it difficult and challenging? And if so, like, how did you maneuver through them?
So I was not looking to compete with hospitals. Actually, I thought it was a great opportunity because since diagnostic services were largely in hospitals, I still remember when I got married, and I got married before I set up Suburban. I had to do a blood test before I got married for a particular condition. I went to Bombay Hospital all the way to do a blood test. And that's what sort of triggered that, why do living in Andheri, I have to go all the way to Bombay Hospital? And I think it was an opportunity because of the fact that there were labs within the hospitals. Can we have labs outside hospitals? So I think it was an opportunity for me. But was it a challenge? Of course. I mean, it's always challenging to start something new. I had never run an enterprise. Neither my wife nor I, and my wife is the co-founder of Suburban. Neither she nor I had ever run an enterprise. So everything was learning on the job. And that is why I think when the introduction you said from one location to 250 centers, it took us 10 years to go from one to two.
Okay.
So those first 10 years was learning on the job. What I call is I did a practical MBA. So, I learned everything about running an enterprise during those 10 years.
Yeah.
And a lot of failures, lot of challenges, lot of hardships, but everything was a great learning for me. I mean, I'll give you an example.
Please.
So we had this patient who was a diabetic, and he was a graduate from IIM, IIT.
Okay.
So best institution, so top level management consultant. He and I somehow became good friends. So he would come back in the evening to pick up his reports, and he would sit with me and he would say, "Doc, show me the reports. What does it show?" And I would discuss his blood tests with him. And then he would tell me, "Doc, let me see your reports." I said, "But I haven't done my tests." He said, "I'm not talking about those reports. I'm talking about MIS." I said, "What is MIS?" I said, "I know what is MISS." Because I had to write miss some in the name of the report. He said, "No, Doc, MIS, Management Information Systems. You don't know that?" I said, "No, I don't." And that was a learning for me that you can't just run a business or run an enterprise without looking at your
Data.
spreadsheet, without looking at data, without looking at numbers. Are you making money? Are you not making money? Are you profitable? So these were all learnings for me. I had no idea. As a doctor, you don't learn MIS, right? So it started from such basic things. Today, because of those 10 years, I can have a conversation with a finance professional like you guys. I can have a conversation with a sales and marketing person. I can have a conversation with an HR person or logistics or supply chain. I learned all that on the job. So that was perhaps, it took me 10 years to go from 1 to 2.
Yeah.
But then from 2 to 15 took another, I would say 7, 8 years. And then 15 to 250 was the remaining part of the journey.
Was delegation a big part of it? Like after you started expanding to multiple centers, did you get better in the skill of delegation as well? Because that's a very important skill set in the world of business as well.
So when we started our second center, our first center was in Andheri and our second center was in Kandivali. So which is 16 kilometers north of Andheri. So I used to manage the Andheri lab and my wife used to manage the Kandivali center.
Oh.
So I guess delegation in that sense happened automatically because both of us, were there. But then I think she managed that center so well. She brought in a team of female professionals. So it became known as that female center. So Kandivali actually gave us the confidence that this is a model that we can scale.
Yeah.
And the first pathologist I hired, so until the second center, I used to do everything myself. But then it took a toll on my health. And I also realized, so there was a very important lesson that I learned, that I used to sit behind the microscope and look at every patient slide myself. Because that is what I was trained to do and I was good at it. I also realized that is where I'm comfortable. Because I'm secure behind the microscope because that is my area of expertise, right? So if you are a chartered accountant, you're very good with balance sheets and things like that. So then my father told me once, he says, "Ye to acha hai, you are doing a good job sitting behind the microscope. But do you think you want to create more of you sitting behind the microscope and you coming from behind to the front of the microscope? Then you can build more centers." So it took me 1 year to hire a fresh pathologist. Took me 6 months to train that person. It took me another 6 months to let that person start reporting independently. So it was difficult for me to let go.
Yeah.
But once I got that confidence and comfort, and I was able to move from behind the microscope to the other side, then I was able to create lot many more microscopes and put people behind. So today at Suburban Diagnostics, we have close to 50 full-time pathologists.
Okay.
And when we merged with Dr. Lal Path Labs, today there are more than 300 full-time pathologists. Dr. Lal, like myself, is also a pathologist. But letting go of your comfort zone is only where we allowed the growth to happen. So as they say, right, growth happens outside your comfort zone.
Yeah.
It's very true in my case.
What was the feeling when you started getting your first paycheck? When the first center started becoming successful, what was the joy? What was the emotion, right?
That's a very interesting question, Harsh.
Yeah.
So before we started Suburban Diagnostics, I was a lecturer in JJ Hospital.
Okay.
So after finishing my MD, you get a lecturer's post. So my salary at that time was 5,700 rupees.
Okay.
If you ask Anju, my wife, she said that was the best salary that she ever got. Because once you become an entrepreneur, you don't really draw a salary. And that's a mistake. And I've seen that happen in today's day and age also, that as an entrepreneur, you are a business owner, but you're also a professional. You don't book the cost of a professional. So when you have to find a replacement for yourself, then you suddenly realize, oh, I have to hire a CEO and I have to put cost to it. And then your P&L doesn't look the same as it looked before.
Yeah.
If you own real estate, you don't charge rent because this is my own. But when you have to open another center, you have to start paying rent, then you realize. So sometimes you don't look at all the true expenses in the P&L the way it should be looked at,
Yeah.
especially as your own cost. So honestly, I never took a salary for many years. It's only after when we looked at becoming more structured and more corporatized, then the chartered accountant said you have to give a salary to yourself and to your wife, because while you're business owners, you're also working full time in the business. You have to give yourself a salary. So Anju still feels that 5,700 rupees was the best salary that she ever got.
Put very content
Yeah,
way.
very interesting.
Yeah. And a follow-up question on this is, you were bootstrapped, correct?
Yes,
You
yes.
were raising money post, like way later?
No,
or
no,
you
bootstrapped is, I mean, I don't know if there's a word lower than bootstrap, chappal strap, or something. I don't know if there's a word like that, but the wind beneath my wings, like most of us, is my parents, my father. So he invested in the first real estate that we started the lab in, and he helped me get seed capital. So we got 23 lakhs of seed capital from Maharashtra State Finance Corporation. So for that, you have to put in 25% and they give 75% or 80% they gave. So that's 7-8 lakhs plus the real estate at what my father put in. And then we got the balance from Maharashtra State Finance Corporation. And that is how we really started.
Is that the reason, doctor, that you refrained from like taking that salary in the initial days? Because I feel a lot of entrepreneurs now, it's like not that they don't want to earn that salary every month. It's like a guilt that the company has to reach a certain height, a certain level, and that's when I feel I'll be worthy to like draw salary. You think it's that?
It's a mistake. It's a mistake. It's a mistake that I made. It's a mistake with most founders make. See, you are both running your own enterprise, right?
Yeah.
You are owners or partners in the business, which is great. You're wearing the hat of a shareholder, which is to take out percentage of the profits. But you are also working full time in the company, right? If you did not work in the company, somebody in that position would work.
Very true.
You would have to pay that person.
Very true. Yeah.
So you must pay yourself. Don't say, I'll only take 10,000 even though I deserve 1 lakh. Because when that person comes, actually, you have to start paying 1 lakh, it will hit your P&L.
Yeah.
So you may say, okay, I'm booking the 1 lakh. I'm only taking 10,000 because I don't have the cash flow. But your P&L should show that the company owes you 90,000 rupees every month.
Yeah.
So it's a mistake. When you have to raise capital, right? Any investor is going to look at true cost. He's going to look at market cost. He's not going to look at the 10,000 rupees. He's going to say, I'm going to add the 90,000 rupees. So if you start adding that right from the beginning, you know your true value of the company right from day one. It's not that you think my profitability is this, but when you go to an investor, the investor sort of reduces the profitability. Says, अरे यार, rent तो charge नहीं किया तुमने, salary तो ठीक से नहीं दी.
And talking about the paycheck cycle, how have you seen your lifestyle evolve? Because from 5,000 rupees salary to an owner of 250 centers, right? How do you now spend your time with your net worth at this level? Are you focused on investments and growing it for the next generation, or are you relaxing and you just want to chill out and
So when you are a student at JJ Hospital, right, and that's in Baikala, and I used to stay in the hostel most of the time. But I used to get a dabba from home, and the dabba walas, no, bring the dabba.
Yeah.
It's 40 years. I still get dabba from home every day. So that gives you some context that whether you're a student or you are so-called a successful entrepreneur, you still eat the same from that same dabba. I have a very important tagline that don't compromise your life with your style. That is the true meaning of lifestyle.
Yeah.
We compromise our life with our style. Finally, you're going to eat 2 chapatis, 1 dal and 1 sabji. And at that time, my dabba had 4 layers. Today, my dabba has got only 3 dabbas. The dabba wala ka dabba has 4 dabbas in it. The last dabba was always having mithai. Today, I'm conscious. I don't want to. So actually, the diet that I used to eat then and what I eat now has actually come down.
Yeah.
When you have some money in the bank, it at least allows you to fulfill your passions. And you don't have to work for money, but you make the money work for you. But lifestyle really does not change. I think you can probably get maybe a nicer house to live in, but you're still going to eat the same food. And your friends never change, no matter what. So this year is 40 years since I started MBBS. And we were a group of 20 friends that we became a very core group. In the 200 batch, we were 20 of us who were very close. Half were girls, half were boys. So girls obviously got married and they went their own separate, but we are still in touch with them. But the boys still meet. In 1988, after we finished MBBS, we went on a road trip to Nainital.
Okay. From Bombay.
So, we took the train, 3-tier train. That's all we could afford. Then in 2018, 30 years after we finished MBBS, the same 9 boys met this time in Amsterdam.
Okay.
nice.
And then this year, in March this year, 40 years since we started MBBS, the same 9 of us met in Berlin and Prague.
Beautiful.
So some things just don't change in life, and friendships never change. They just keep getting stronger.
But doctor, I have a question. See, now today, I mean, on social media, the youth gets criticized or overly criticized at times for having this hustle culture because they don't want to hustle just to make a name or to make a brand. They want to actually hustle because they want to meet their lifestyle needs. And the lifestyle needs like sets them in this circle of like just, okay, get the paycheck, spend it, get the paycheck, spend it. So to combat that, what would be your top 2 suggestions to like the youth, anyone who's listening right now?
It's a generational evolution, right? So if you ask my father what was his lifestyle, and he would look at my lifestyle and say, "Yaar, this is too extravagant." Although I might think, no, my lifestyle is okay. I'm not doing those many things. So my father came from Pakistan during the partition and started his life with just the clothes on his body to build where he is today. So he never had the lifestyle of getting a club membership or going for a movie to a multiplex or going for an international holiday. Nothing like that, which happened in us. So I don't think he can blame me for my lifestyle. And similarly, I can't blame the next generation or my kids because they have been born into a different system, right? I mean, everybody is digitally connected today. Everything is instantly available. We live in a world of instant gratification.
Yeah.
It's not your fault or the fault of the current generation because that's the way it is. The current generation has to figure out how to make it happen.
Yeah.
But there is a difference between value and valuation. I think people are running after valuations at this point of time. How do I get the best valuation for my business? But the best way to get the best valuation for your business is to build value in it. Find a purpose that you are happy to remain committed to. And I know the definition of time of commitment has probably changed. In my father's time, perhaps you would have somebody working for the same organization their entire life. 40, 50 years was common. In my time, maybe I have people who worked with me for 25 years. Today, I think 5 years is a good time. Building a business is not a short journey, so to say.
Yeah.
It will take a cycle. Even a venture capital fund, right, has a lifespan of 10 years. That means they allow businesses to incubate and ramp up over a 10-year period. So give yourselves that time. Don't be in a hurry, is what I would like to tell people, is that use that time of 10 years to build value. Of course, what we did in 25 years because of technology, because of digitization, obviously the whole life cycle has shrunk. But don't shrink it from 10 to 1 year and say, I want to build a unicorn in 1 year. It still takes time. So look at how do you add value. If you are making a difference to something. So it's very important when you start a business, what are you trying to solve? Do the right things, have the right ethics, work hard, party harder. I have no problem with that at all. But don't expect that on Monday I'll become a unicorn. No, that's not going to happen. Give it time. Everything takes time.
I think, Doc, because there's so much digital stimulation all around us, right? And if you see back in the day, the number of triggers that might influence you to take a decision were less or lesser. Now, you constantly on Instagram or Facebook, you're seeing some successful entrepreneur in America, in some other city in India, some person living a different lifestyle which you aspire to live. And then immediately after 3 months, you're seeing a different aspiration. So your aspirations itself are not aligned in a particular direction. So I think what you beautifully put across, it's like give yourself time to actually figure out also what sort of value you want to create, not
Absolutely.
just like ठीक है मुझे आज ये करना है and then after every 3 months 1 year you're changing your alignment because then you're not going to amount to anything. So figure out that value, and once you find that value, stick by it no matter how many triggers and distractions comes your way.
I think you said it correctly, Darshan, that how do you minimize your distractions?
Yeah.
And the other thing that I like to say is control the controllables. It's like when you're driving a car, right? You can only control yourself in the car. You can control the speed at which you accelerate, when you want to brake, you want to give an indicator when you want to turn left or right. You can control what you are doing in the car. If you start controlling every bus driver, every pedestrian, every car on the road, you will forget going from point A to point B.
Yeah.
Control what you can control and hope that everything else people control themselves. So when you try and control more than you can, that's when you get that frustration that, oh God, I'm not able to do this, I'm not able to do that. I could control the controllables, give yourself time, things will be okay.
But I feel technology has not only made us dysfunctional, it's also made us very functional because there's a positive side to it.
Oh yes.
I want to jump into the technological progression that you have seen over your career, where you started with, say, X technology. And how does it look now? Like when you are looking at your centers, and what sort of technology is being used at the moment, and which technologies are you excited, like in the near future, which could be deployed, like AI, VR, all those things?
Again, a long answer to a small question, but 1994 when I started, we didn't have a single computer in our first lab.
Okay.
The only computer we had was when they used to say you are a computerized lab, is when you used to give a printout on a dot matrix printer. I don't know if you know what a dot matrix printer is also, right? So you wouldn't know that. It's one of those continuous sheets of papers that would go into a printer that had a head go trr, 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 like that. Laser printers were not yet there. So anybody who gave a printout on a computerized stationery, which had perforations on the side and you had to attach it and then it would go, that was called a computerized lab. I actually learnt the basics of DOS and all those things from a computer expert from IIT who used to come over once a week to teach me basics of computers. That's where we started. Every patient registration was in a 200-page notebook. Left-hand side was date, name, age. Right-hand side was what tests had to be done. And then 2 columns, how much is paid and how much is balance. Ledger. Absolutely. And Raghu, who was my man Friday, so to say, who would open and close the shutter with me, was also the accountant at the end of the day. Of course, we didn't go more than 1 or 2 pages because we didn't have that kind of workload. But I'll tell you, we never had any mismatch in account tally because Raghu was so particular until the cash tallied at the end of the day, he would not go home only. And he would make me also stay back. Today you have ERPs and all, and you know how people fudge ERPs also. With greater technologies, you have greater complexities also. But we started from that uh, manually to getting desktop computers, to getting some softwares working, to now, of course, it's a fully interconnected system, which is a on the cloud application, which is called a LIS, Laboratory Information System, truly world class. Uh, we used to label every sample manually. Today, everything is barcoded. Uh, everything is end to end coded, that we know from where the sample came. We can track the sample. We know how much time it's going to take, when the report will be uploaded. Everything is digitally given to the patient. They get the reports uh, on their phone, into their emails.
How expensive are these softwares? Can a person who's starting his entrepreneur journey in this field, can they deploy this software, or it's at a later stage of
There is
evolution?
no option today. You have to do it.
You have to do it.
I mean, everybody has evolved, right? But of course, the affordability has also become much easier.
Okay.
There are software of different types, of different sizes. So every lab can afford it. Absolutely.
So these are the business operations softwares that you're
Yes.
referring to. Also, what about the machinery? Like, so disclaimer, I'm a Suburban client since the last 10 years, me
Right.
and my family.
Right.
So I've been to your Jew branch. I also have the guys coming home.
Right.
Like as a family, we believe in preventive healthcare, and every 6 months we do the full body checkups via your clinic.
Thank you.
So those machines that I've seen in the clinic, right?
Yeah,
Just if you can tell us and the audience, how expensive are those, and are these machinery imported? Like, to be called a world-class clinic,
Yeah.
you need to have the best engine, right, in the clinic. So, what is the story behind that?
Yeah. So when I was studying in the US, before I started Suburban, I got access to truly world-class equipment. And I said that, there's no reason why I can't have the same in my lab in India. That 23 lakhs that I raised, right? Most of it I used for equipment that I got from the US. Not realizing that it's not just about the equipment, but it's also the people behind the equipment, or the company that supplies you the equipment, but is just as important. So unfortunately, that equipment did not have great after sales support.
Oh,
So within a year of buying those equipments, all those equipments failed.
Oh,
all of them.
All of them failed
Oh,
because they
That's
were
a
not meant
big setback.
for the Indian ecosystem or
Okay.
the Indian environment, and they didn't have trained support staff. They didn't have after sales support out here. I still retained those equipments in the loft for the entire duration as a reminder of what mistake I made, so I don't make that same mistake again. I then started to work only with reputed global brands, uh, whether it is Boehringer Mannheim, which became Roche Diagnostics, Abbott, Siemens, Johnson and Johnson, Becton and Dickinson, Horiba, Sysmex. These are all truly world-class names. Roche Diagnostics hosts something called as India Days in their headquarters in Switzerland. So they called 5 of the most prominent customers from India, and I was one of them. I'm very vocal about what I demand from these suppliers, because I want to make sure that the customers or the patients get the best. And since you were saying your family is, dependent on the tests, as is everybody. See, for me, uh, the bottom line is always quality. So quality of the results, quality of the experience, quality of the service, quality of the reports that you get, everything. I only think about quality. So getting that equipment, the best equipment in the world was, there was not even a second thought to it. And I always fight with these global MNCs that don't treat India like a third world country, because our expectations are first world. Our expectations are not third world. So please don't give us anything which you don't give in the West. So I would make sure that we only got the world's best equipment. I could not afford it initially. So the first Boehringer Mannheim, now Roche equipment, was actually a refurbished equipment that I got from a second-hand supplier. And I had to strip down the equipment, rebuild it with one of the technicians from scratch, but that gave me so much of understanding about the equipment that I knew every part of the machine myself. From there to where we have today, we have, the Ferrari's equivalent of diagnostic equipment. Whatever is there in the world, it's there with us. So the quality of the reports that we generate is processed on truly world-class equipment, second to none. What you get here, in fact, there was somebody who came from Europe to visit and audit our lab. They said, your lab is perhaps better than many of the labs we see in Europe.
Wow.
So that was a big testament for me. And then we went in for something called as accreditation. We were the 67th lab in the country to undergo something called as NABL, which is National Accreditation Board for Testing and Calibrating Laboratories,
Okay.
which is not mandatory even today. Uh, Today there are close to 3 lakh laboratories in our country, but less than 2,000 labs are actually accredited. So it's not even 1% of the labs that are accredited. Of the NABL accredited labs, it's a handful, less than 100, which are accredited by College of American Pathologists. So we are one of those few labs in the country that has both NABL and College of American Pathologists or CAP accreditation. So we continue to push the boundaries, testing ourselves against the world benchmarks, that we are not good enough just to be a good lab in Andheri West or Juhu or in Mumbai or in Maharashtra or in Western India or in India. We are equivalent with any best lab in the world. And that's the quality that we continue to give to our patients no matter what.
I have a business question over here. Now, when you're pursuing quality and excellence in like every particular domain, whether it's your technology that you're using or whether it's the paper printout that you're giving or it's the service staff that you have, is how difficult is it to manage your costs? Because sometimes, like, in India, you have the jugaad mindset. Arey, jugaad ho jayega, like, fix this. Like, it's like a makeshift solution for something. So, in that scenario where you had to focus on quality, how did you resist the temptation of like submitting to that jugaad mindset? A, and B, was there resistance from people around you that like, अरे क्यों कर रहे हो ये सब, हो जाता है काम?
Darshan, there's only one way I've thought about my enterprise. If it is good enough for my family, only then it is good enough for my patients.
Wow.
If it is not good enough for my family, it's not good enough for my patients. If I did jugaad, would I do jugaad with my own family? Would you do jugaad with your own family?
No.
That has been my way of thinking. If the toilet is not clean enough for my father to use, it's not clean enough for the patient. If my wife cannot lie on that bed because the bed is dirty, it's not good enough for a patient. If the quality of report is questionable for my family, then it's obviously going to be questionable for the patients.
It's a matter of life and death. You can't
So
compromise.
there is no compromise. I have never thought about, unfortunately, on cost optimization. I learned that maybe later in life when we were looking at valuation of the final end product. But I mean, I don't have any regrets on that. I'm sorry. But I've always, like I said in the beginning, I've thought as a doctor.
Yeah.
I continue to think what is best for the patient.
Yeah. And in the course of this duration, because of this mindset, I feel like you have built a brand so solid because you can get away only so far by doing jugaad. But if a customer knows that I go to Suburban, I always get this certain standard of experience, certain standard of quality, then you have become a brand. Because a brand is not like changing your logo, right? You can change your logo tomorrow, but Suburban will be Suburban.
Absolutely. I think over the last 30 years, what we have been able to build is that confidence in people. See, we realize that nobody comes to us because they want to come to us. Healthcare,
It's a need.
nobody comes to you because they want to, it's because they have to.
Yeah.
So only if you do something will people think, okay, tomorrow if I have to do a preventive health check, let me do at Suburban. Why do you choose? How do you make a choice? It's how you put the right pieces, at the grassroots level for people to make the right choice. So I tell my staff, for example, that our shift starts at 7:30 in the morning. So people who come in the morning fasting and all, between 7:30 and 10:30, the staff is also fresh, everything is working well. The same staff is leaving at 3:30 in the afternoon and a patient walks in at 3:15. it is the first encounter for that patient, but the last encounter for the staff. Just because it's the last encounter does not mean you can be casual about it, because for the patient, it's still just as important as it was at 7:30 in the morning.
Yeah.
So you can't drop your guard just because it's your last patient of the day. For you, that quality of interaction never changes. You can't drop your guard no matter what, especially in healthcare. That's what I feel. You're always in a boxing match. You have your two hands here.
Yeah.
One hand is to punch and one hand is to protect.
Yeah.
The moment you drop your guard and you become casual,
Yeah. It's over.
you're going to get hit.
Yeah.
So, and since this conversation started with the word technology, what are the latest advancements that we should all be aware of in this field, especially preventive healthcare? What is the latest development that you would like to share with us?
So, Harsh, one of the biggest developments is the evolution of the testing menu. When we started, we had a very limited menu of tests that we were exposed to. So, like vitamin D was not even a test available at that time, let me tell you. Today, can you think of any health checkup without vitamin D? It's commonplace. So vitamin D is a test that came about 10 years ago. Today, we are taking it to the next level. And since you said preventive healthcare, and we are three of us in this conversation, and we take the same medication, we don't know whether it'll react well with me or with you or with you. But if you do a genetic test, you can actually know who is a responder and who is not a responder. So from preventive healthcare, we are moving to personalized healthcare.
Okay.
And this whole advent of genomics and genetic testing, according to me, is going to revolutionize the way in which healthcare is going to be practiced. So today, a doctor uses his or her intelligence, knowledge, experience, clinical acumen to make a diagnosis and treat. If you add on top of that this layer of genetic data, which is sitting, and I know that Darshan is, I have to give this medication, Darshan is not going to react well, so I don't even try it on Darshan. I give him something else. So this whole trial and error, gut feel, experience based is coupled with data driven decision making. And that, according to me, is going to change the way healthcare is going to be practiced in the future. So genomics and genetic information is going to become the mainstay how healthcare will evolve over a period of time.
Is this the same as CRISPR, the CRISPR technology, gene editing?
CRISPR is the technology for genetic testing. So there are multiple technologies. Yeah, CRISPR is one of them.
Okay.
CRISPR is actually used more for what we
Editing.
call as gene editing.
Yeah.
That's the next level.
Yeah.
That if you have a genetic disorder, you use CRISPR technology to edit the gene,
Yeah.
to modify so that you don't present with the symptoms of that condition.
Yeah.
This is my wish list now going forward. So my daughter is also a pathologist from Tata Hospital. And when she got into pathology, very excitedly, I went with her, bought the books and all. The author is the same. Robbins is the Bible of pathology books anywhere in the world.
Okay.
But the Robbins that I had did not even have a chapter on genetics. Today, they have full books on genetics. So I'm taking online courses from Harvard to upgrade my knowledge on genomics. And I believe time will come when every newborn will do a genetic screen at birth, and then we'll also have a genetic screen 30 years later. And then the doctor or the healthcare professionals will have this information to take data-driven decisions along with their clinical acumen to make stronger prescriptions.
Yeah.
Better diagnosis, better treatment, less side effects, picking up conditions earlier, making people live longer and healthier.
It could be doctors or it could be AI as well. Like, if you plug in AI over here to just analyze all the data over the past 30 years, like compare that data, compare this data set.
No, AI is going to be extremely important for comprehending genetic data, because when you do genetic studies, the data is just enormous. You need technology like AI to make sense for it and bring so much of data into one sheet.
Filter the whole thing.
Yeah.
Beauty of this, sir, that you're looking forward to some new technology and the whole transformation in your industry. Is it a motive for you as a thought leader in this field? Are you on the lookout for such new technology to bring to India into the Suburban Labs ecosystem?
You're asking such good questions here. So let me start with cancer, for example, right? When you have a tumor, the only way to diagnose a tumor is to take a biopsy. And a biopsy is you cut the skin, you go into the tumor, you take a piece of the tumor, and then you study it under the microscope. That moved to something called as fine needle biopsy, that you don't need to cut. You just through a needle, you pull out some cells and you study the cells on a slide. So I studied the biopsy part and I studied the needle biopsy part of it. What is the future is something called as liquid biopsy,
Okay.
where through a blood sample you can detect cancer.
Okay.
You get what we call as circulating tumor cells in the blood. So technology is going to reach that level where you don't need to do a biopsy anymore. You don't need to put in a needle anymore. You just take blood sample, and through the blood sample you can pick up who has cancer, who does not have cancer, what type of cancer, what is the stage of cancer, is the treatment working, is the treatment not working. And I am very keen to see how do we bring liquid biopsy uh, to the country. It's still evolving globally also, it's not mainstream. So I want to try and see how do I bring that and make it commonplace, for practitioners in India to use liquid biopsy. So that's
How accurate are these tests, the liquid biopsy
so
tests?
it's evolving.
Okay.
It's evolving. I'm hoping in the next few years it will become just as accurate as doing actual biopsy.
And I have a follow-up question. Like when I'm visualizing this liquid biopsy, if someone has a cancer in their lungs, do you have to take blood sample from that organ or is it anywhere?
From the vein.
Okay, so it's very convenient. It's
Yeah,
just
yeah.
like,
So the biomarkers for lung cancer, biomarkers for other, that's the technology. It'll pick up what type of cancer it is also.
I'm just like having this wild thought in my head. Like I'm imagining a world where you're having like these devices, micro devices, or it could just be an application on your mobile phone where you just take a sample of you self-medicate yourself. You take your sample of your blood and you just put it on a particular device, and it gives you an entire data of like what's currently wrong with you, what's currently fine with you, which areas are in orange, like which could go to red. So what you have to be precaution. It's like a pocket doctor sort of a technology.
That is the reality.
Okay.
I'm going beyond that. It'll go to a point where the lab will come into a microchip which will be implanted under your skin. So you don't need to do a test. It's real-time analysis of your blood, which is connected to the cloud, which is going to your healthcare supply, your healthcare provider. So lab on a chip implanted in your skin, giving real-time data to anybody who needs it, or you give permissions to.
Yeah.
So it's going to move to that level actually.
Yeah.
These apps that are there like Ultra Human and all, I mean, they are trying to optimize digital biomarkers.
Okay.
So when you wear a wearable or
Yeah.
Aura ring or your Apple Watch or whatever, you get digital biomarkers.
Yeah.
How many hours did you sleep?
Yeah.
How much did you walk? How many calories did you consume? So converting all that into consumable health information that you can use to your advantage.
Yeah.
So your organization played one of the most important roles in the nation during the pandemic. I personally had taken a lot of RT-PCR tests from Suburban, and that experience was very, very good and very assuring when you would get the negative test result, obviously. Would you like to share the stories that went through your organization, how you all tackled this, how
Yeah.
you all working with the government? There's a lot, I know.
There's a lot.
So
There's
for
a
you
lot.
to summarize it in this short conversation, I know.
Yeah. So
Yeah.
the story of COVID starts before COVID. And it started when we had this pandemic or epidemic of H1N1, swine flu.
Yeah.
That happened about 3 or 4 years before COVID hit. The platform or the technology needed to test for swine flu is called molecular diagnostics. And Suburban Diagnostics was not equipped with that technology at that point of time. So the small team that we gathered, we thought, we should be a part of this. We must have the technology available to test for swine flu. And why is it that we don't have this? So we went all out and we, procured some infrastructure and equipment and got the right team in place. And then we went, I personally remember going to St. George Hospital where they have the cell for giving approvals, made an application, and fortunately we were given the permission to test for it. So we tested for swine flu. Not a big volume in terms of business, but I felt satisfied that we now have the technology. And that technology can be used largely for either infectious diseases or cancer. There are two big applications for that. So we said, let's focus on the infectious diseases side. But I said, before doing that, as has always been my habit, that we will go in for NABL accreditation, even for molecular diagnostics. Even if we have to do this, let's do it fully well. So my team said, no, it's not required. It's very expensive. Anyways, we're hardly getting any workload out here. Why are we spending so much money? This is not going to work. I said, no, करना है तो अच्छे से करो, नहीं तो we don't want to do it half-heartedly. So went ahead and got enable accreditation done. Cut to March 2020. The government of India, when they had to appoint labs for COVID testing, looked at all the labs that have molecular diagnostics, that are NABL accredited, and that had done H1N1 testing. Because the type of virus that H1N1 is, similar is the COVID virus. It's RNA virus. So on 20th of March 2020, 4 labs in the country were approved for COVID testing. We were one of them. We had already started the work 4 years ago. A month before that, I told the team, again, this is just gut feel of an entrepreneur sometimes, right? That go ahead and find where the kit is available for COVID testing. There was no lockdown, there wasn't anything. It was still in China and Southeast Asia. But I said, I don't know when. Let's go ahead and get the kit. We figured out where the kit is available, got the kit, standardized it, sent an application to ICMR that we are ready with the COVID test. No response, nothing happened to that email. But on 20th of March 2020, we got the approval that you have been given approval for COVID testing. Because we had all the kits, everything ready, we put our hand up and said, we can test from tomorrow. So it took a couple of days. 24th of March 2020, we did our first COVID test. And why I remember that date so well, it happens to be my birthday on 24th of March.
Oh.
The whole world was on the back foot with their backs against the wall. We were one of those few healthcare service providers in the world given the opportunity to come on the front foot and to help.
Yeah.
So it's a huge privilege,
100%.
huge opportunity to make a difference in people's lives.
Yeah.
My phone number was given to the BMC as the helpline number. So on my birthday, I got 350 calls asking how can we get a COVID test done. So 350 birthday wishes in a different way, if I can put it that way. Of course, then I transferred that number to somebody else in the team eventually. But that is how we started. So we started with doing 1 or 2 tests to the Delta wave that happened. We were doing 15,000 tests a day. Our corporate office was broken down, converted into a COVID lab. So we were all working remotely. We didn't have a corporate office.
Okay.
The entire leadership team was on the ground, in the trenches, working with the team, motivating people. How do you convince people to go to somebody's house, wear that PPE?
Yeah.
So we were there, I was there, the entire leadership team was there. Once the first 2 technicians got convinced, it became like a snowball effect. And the entire team then volunteered. We had to recruit part-time people to manage that. Then we had multiple shifts. And if somebody in the shift tested positive, then the entire shift was isolated for 10 days. So then to manage with just one shift, we had to rent out hotels close by because people could not go home. We had ambulances that would go from 4 a.m. in the morning to people's houses to pick them up and bring them to the lab and then take them back with BMC permission. Public-private partnership at its best happened during COVID. And that is how I think India managed the crisis beautifully. ICMR played a phenomenal role. State governments played an excellent role. Private labs stepped up. All NABL accreditation happened online. From few labs, few hundred labs came up. What used to cost 4,500 rupees for a test right at the beginning ended up costing 300 rupees. Suppliers brought down cost. We learned how to optimize. We never once stopped. Even if the cost came down, we didn't stop testing. I mean, we feel extremely proud that, at this point of time, we were able to give back. And I think this was perhaps my crowning glory, if I can call it that. We were able to truly give back to society what we were made to do.
Thank you for sharing this. It means a lot, and the efforts the whole team and the whole country put together is
absolutely
incredible to get us out of it.
Yeah.
And one more thing that comes to my mind is, one thing is managing it, then diagnosing it, and then giving the patients the right
Result.
confidence and result that okay,
Correct.
this is where you stand and this is now the next step for you all. And recently I read again, the timing is so odd that it's come in the news again that AstraZeneca said something that basically there are some side effects.
Side effects of the
What is
vaccine.
your take on that?
All vaccines have some side effects. Generally, a vaccine takes 10 years for getting approval. But this whole thing was fast tracked by various agencies and WHO. Of course, the technology with which the vaccines were developed and now is also evolved. Uh, I think the benefits far outweigh the side effects. Yeah, there are people who had side effects, no question about it. Uh, how many of them were genuinely due to the vaccine or otherwise still remains to be ascertained. Yes, there were some side effects, but I think the benefits far outweigh the side effects. Far outweigh. There were people who did, who did some, who did have some negative impact of it, and I think people lost lives also because of this. But lot many more lives were saved because of it.
During this whole phase, like, you did a great service to everyone around you, but how did you keep yourself in check? Like, because you are managing an organization that is in the front lines of like a war, you would say. You are the general along with other generals. There's so much uncertainty in the whole world about what's going to happen. Nobody knows what's exactly happening. And then you have to take care of yourself as well. I know in these moments, like great leaders don't really put themselves as the focal point. They are looking outward and seeing what service they can do best. But it's critical that you also function best, because if you break down, then everything collapses under you. So how did you manage yourself during this phase, and what's your mantra like towards life, to managing like a well balanced life in terms of your professional life, your personal life, and health in
Sure,
general?
sure. So I mentioned to you earlier about those equipments that I had bought from the US, and all of them failed after a year. So in 1995, and we had started Suburban Diagnostics working 365 days. And who was the person working 365 days? Me. I couldn't expect staff to come every day, but I used to go every day. So one is going every day to work, including Sundays. Second is equipment's breaking down. So the stress of uh, the equipment's failing and working continuously. In 1995, I got fever for 5 months.
5 months straight?
5 months straight.
Oh.
So May, June, July, August, September.
Oh god.
My fever finally subsided in October. And me being from the healthcare industry, having access to every possible doctor, met everybody. Uh, and my wife was pregnant at that time. She had to manage me, manage the lab, manage herself, manage whatever, I mean, everything. Fortunately, in October, before my second daughter was born, my fever also came down. And here I am. So I learned a very important lesson, that to look after anything in life, you have to first look after yourself. If you look after yourself, then you are in the right physical, mental, and emotional state to look after anything else. If you are healthy, then you can take care of anything. You want to travel for a holiday, but if you are not healthy or your body cannot manage it, you cannot. If my jug is empty, how am I going to give water to anybody else? I have to
Absolutely.
first fill my own jug.
Yeah.
A friend of mine told a very nice line: to be selfless, you have to first be a little selfish. So look after yourself first, then look after everything else in life. And that is what I do today, that I spend good amount of my time on my physical health. So I have a personal trainer that I work out with 3 days a week. I play a sport. So I used to do cycling quite a bit over weekends. Now I'm playing golf.
Okay.
And people think it's a very lazy sport. Let people come and try it with me. It's not lazy at all. I'm learning how to play pickleball now with Bhavin.
Yeah.
So I mean, I play a sport, I swim, but I work out 3 days a week. I'm looking to keep my weight under control and keep coming down. I have a target that I want to achieve by end of this year. I'm trying to eat healthier. All this to make sure that I lead by example. If I want my wife to work out and I'm sleeping in the bed, that's not showing the right way, right?
Yeah.
Because I go to the gym, then I tell her, why don't you come with me? Similarly, anything in the corporate world also, I always believe lead by example. If you want the team to come on time, but you come late. It's not going to work. If you want the team to dress in a particular way, but you dress in chappals and shorts, it's not going to. So 30 years of Suburban Diagnostics, I've never once gone to work not having shaved in the morning. It's not a big thing. Both of you have beards, so so I think that's a shortcut way of doing it. So you don't have to shave every day. As a leader, try and command respect and not demand respect. And many leaders end up saying, I am the leader, I am the boss, demanding respect. That doesn't work. Doing things the right way, remaining humble, adding value to people, adding value to yourself,
Yeah.
then you start commanding respect.
Beautiful, sir. Like I have not shared this on the podcast before, but like literally you mentioned lead by example so many times. Like even I try to follow that principle. I've literally got a tattoo of it on my like this ductus exemplo. This text in
Wow.
Latin it means lead by
Lead by
example.
example. Yeah, yeah.
Yeah. So
No,
like
I truly believe in that mantra. I mean, absolutely.
yeah.
I started doing, so, you have people coming to your house. I used to do that for 10 years. A big corporate lab opened in Lokhandwala, and we were not inside Lokhandwala, we were outside in one small gully. So we felt very intimidated that this corporate lab is going to, take away my business. So they said, instead of the patients coming to us, can we go to the patients? And that is how the concept of home visit started. Because of an adversity, we started with that. And who used to go to the home? I used to. So every morning at 7 o'clock, I would reach the lab, the bag would be ready. From 7 to 10, I would go door to people's houses. The experience of doing that is what has allowed us to build this home visit team over the last so many years.
So sir, you built something like from your heart, like with all these values and this journey that you described, and when you decided to move to the next phase of life, like when you decided, okay, maybe I need to move on from here, what was that phase of your life like, and how did that look like?
When Anju and I started Suburban Diagnostics, we never thought that we would reach a stage where we have to let go of it. And this was a lesson that I learned later in life, which I think is important for people to know when they raise capital. Private equity is a very expensive form of capital in multiple ways. One is when you have a private equity investor. So we got Sequoia Capital on board in end of 2012. So big achievement in terms of a global marquee brand like Sequoia wanting to be a part of our journey. And when you get private equity on board, you are mandated to give them an exit within a specified time period. When you get private equity, you are running on a treadmill. And you continue to run on the treadmill. That the treadmill is provided by Sequoia, then somebody else will come in place of Sequoia, but you continue to run on the treadmill. So that's a mindset that I was not familiar with when I went ahead with private equity, which I learned much later. But as is my philosophy of ethics, that if I have mandated to give them an exit, I must give them an exit. We had multiple parties interested. Some were strategic investors who are from the industry, and some were financial investors. Because we had already diluted close to 40% of our stake with Sequoia, anybody who wanted to come on board wanted to take more than 50% or take a controlling stake. I would not be able to run the company the way I had always had because I would not have controlling stake. So my operating role would get significantly marginalized. So that's when we thought, is there any other option? The other thing was that during the 28 years that Anju and I ran Suburban, I was never able to switch off. I was 24/7 switched on. So Anju felt that perhaps, you have done what you had to do. There could be a better option where you can now, maybe try and relax a little bit and look at life differently. I had known Dr. Lal my entire professional career. He is like a mentor, like the, almost like the godfather of pathology industry. Uh, and he and I had a very, very good relationship. He was always very keen कि संजय हम लोग साथ में कुछ करेंगे. Dr. Lal was part of the fray of the potential opportunities. I think my comfort lay largely because of my relationship with Dr. Lal. the fact that they wanted to preserve the brand as it is. They didn't want to change the brand. They would keep the team the way it was. So certain things ticked in my favor.
These were big factors.
Big factors, yes. That how will the organization continue, and how will the team feel. So I think, in fact, there was one bid that was slightly higher, but I chose this bid because I felt my team and the organization would be better protected. And I think I chose the right, most eligible bachelor for my third daughter, as I call. So besides Ankita and Aditi, Suburban Diagnostics is like our third child,
Yeah.
and will always remain our third child.
I want to ask you this question now. You have gone through this journey of like raising money, handling your business. I feel a lot of first time founders or like young entrepreneurs, when they are starting off their journey, they are deficit of capital, right? They don't have enough money. They are looking for scraps here and there, or they manage to raise it with their family or friends, or something happens. And when they see some sort of success in their business, and now there are people out there who are willing to give them capital, at that point, because that capital has been lacking in their life was till that point, they might tend to just jump on the first opportunity that comes their way.
Correct.
And that also could lead to like people who don't have the best interest for that particular business exploiting that founder or
Sure.
exploiting that business.
True.
For that young person or that young business person right now looking for capital, what would be like the principles according to you that they should stick by when looking for the investor, where to take money from?
So a friend of mine and I used to live in the same building at 7 Bungalows, and we used to travel by bus to Andheri station, and then we would start chatting. So I would only be interested in sports at that time, and he would only be interested in business and CNN. He's now become a very large investment banker,
Okay.
but he continued to add value to my thinking throughout my entire journey. And he said one thing to me. He said, Sanjay, dilute as little as late. So when he became a big investment banker and we were running Suburban, we had raised money from family and friends, and then we had taken debt, we had taken a bank loan. And then I started hearing about people having raised private equity. So I went to Manish, my friend, and I said, you think it's a good time to raise private equity? He's saying, Dekh Sanjay, I can buy 50% of your company at this value today, but this is not the right time. Continue growing your business, using internal accruals, put the money back into the business, grow the business. I will tell you when it is right. So from few lakhs to crores, we started growing the business, and when we were about 27, 28 crores of top line, that's when Manish said, perhaps now is the right time. When you've exhausted your leverage on debt, you can't take any more loan, perhaps now you should look at private equity. And again he said, when you're diluting, take only what is needed at this point of, don't take more than what you need, because your biggest value is the equity that you have. So we diluted only a small amount. There was a primary and secondary. So primary is the capital that goes into the business. Secondary is what you can take out of it. So of the capital that we got, 80% was primary, 20% was secondary. So that was the first time after starting the company we could take some money out. Perhaps if I look back, I may not have needed that much of primary or of secondary. I should have kept most of it in primary. So as you said, the lure of when you have been bootstrapped and you don't see money, and suddenly you see money, you get attracted to it. So I think that's a very good point that you raised, that take out money only if you really need to, if it's going to make, if it is essential for your lifestyle. Otherwise, keep as much money in the company, raise only that much that you need, and don't dilute your equity. Today, when I meet founders, I find founders having diluted significant amount are below 50%. Some who only hold 20% of their equity. They've just raised a lot of capital. I'm not in favor of that. I feel this philosophy of dilute as little as late continues to hold true even today. Of course, there are some people who say raise money when you don't need it because that's when it's easily available. There could be some merit to that statement, but I believe that don't be in a hurry to raise too much capital. Don't dilute your equity. Take time to grow the business. If you do the right things, capital will always be available. If you are continuing to grow and you continue to remain profitable, there'll always be people interested. And that is what my initial investment banker said, because we kept getting offers of, do you need more money? We can buy you out, etc., etc. He said, look, Sanjay, that if you are continuing to do the right things and year on year you're growing the business and year on year you're showing profitability, you will always have people who will be interested to partner with you, either to give you money or do a merger or whatever it is. So and that has worked for me at least.
Thank you, sir.
So you enjoying pickleball, sir? How many times a week are you playing it?
Bhavin likes me to play, so Bhavin and I work out together at the gym, and invariably he'll leave 10 minutes before the end. He says, Dad, I'm going to play pickleball, come and join me. But he is very good at it, so I'm still, so he and Ankita play pickleball once a week. I'm quite enjoying, because I've played racket sports like squash and tennis. So yeah, it's not bad, but I'm not doing it as regularly. I'm right now fixated on golf. It's a very, very challenging and difficult sport. Again, as is, I want to be good at it.
Yeah.
And my next door neighbor, who's my very dear friend, he and I have started playing together, but he's become much better. So I'm like, pushing myself. No, I have to become better at it. So I'm focusing more on golf at this point of time.
And with the focus on fitness, and what is the focus on diet, sir? Because whatever you eat, like you
Yes.
said, preventive, we were talking about preventive healthcare, right? So now the world is so focused on nutrition and what we are consuming.
Right.
The first thing that comes to my mind was recently, these companies had to change their packaging because of the sugar content.
Right.
And a lot of social media reels went viral because
Correct.
they were displaying something else. And
Right.
what is your take on that? You've been on the backside when you've seen the results.
So let's look at weight management, right? 70% of weight management is due to diet. Only 30% is because of exercise. People feel that just because I've exercised, I can go and eat a great meal and all. No, it's not that. It takes 1 hour to burn 400 calories. It takes 3 seconds to eat one slice of pizza and it's all gone.
Yeah.
So what you put in your mouth is very, very important. You know what they say, right? I'm trying to remember that line. A minute on the lips, permanently on the hips. So
Well said.
our taste buds are our biggest enemy. So I've been doing intermittent fasting. So the days I work out, I have a proper good breakfast. The days I don't work out, I don't have breakfast in the morning. So I have a dinner the night before and I have lunch the next day. And for me, it has definitely worked. So I think portion control, it's not about what you eat, but also how much you eat.
Right.
So a friend of mine always said that get up from the table feeling slightly hungry. Don't get up feeling overfull. We tend to say, "Yaar, thoda aur de do, let's eat this, let's eat that." And oh God, I'm feeling so full. Get up feeling a little hungry, still that you could eat some more.
80% rule.
Yeah. So, portion control, intermittent fasting,
Avoiding sugar and stuff like that.
sugar, absolutely. I think, see, sugar is essential because it's the energy that we need. But you have excess fat, then the only way in fat will get consumed is if you reduce your sugar. So somebody like you guys, I think perhaps, you don't have excess fat. So obviously you need the sugar, but somebody who's got more fat, then they need to cut down sugar, because only then will the fat reserves be used for energy, then the fat will come down. But if you continue to eat sugar, the fat will also continue to build up. So I think it depends on individuals. I think diet plays a very, very important role. And people say, what is a good exercise? So I say good exercise is neck exercise for reducing weight. So say, how does that work? I say, when people put food in front of you, just turn your neck like this and say no.
Well said.
So that's a good exercise too. That exercise helps your diet also.
Yeah.
And you're very active on social media, sir. And
I am.
Before this podcast, we were having a look at your profile. What led you to get into the content creation game? Is it more for awareness and to help people, like you just said?
Right. It started off being the face of Suburban Diagnostics. I think creating a social media presence for Suburban, I was the face of it. But because I enjoyed it so much, I have now let it become more like a personal brand opportunity. Getting to speak with smart young men like you is again in that same direction. I must tell, that speaking or public speaking is one of the most feared things for people. And I took speech therapy for 4 years during my school days because I used to stammer a lot.
Okay.
I still do when I get very excited or very angry, I still stammer a little bit. But for me to wanting to become a public speaker was unthinkable for me. But today I look forward to such opportunities where I can share my journey, share my experiences. I hope I'm able to relate and people are able to relate to me because this is all real. This is what I've actually gone through.
Yeah.
Uh, and that's my purpose today is to share as much as I can with the people through social media, through maybe being invited for a talk or whatever it is. That is my endeavor today, giving back. I think you must have a role in society. I think we all live a very blessed and cherished life. Uh, Find ways to give back. There's a lot more pleasure in giving than in getting.
I read this quote the other day. It came across on my Instagram reel. Think less of yourself and more of the world, and that's where you'll find the max. I'm totally like butchering the quote now, but that's where you'll basically find the maximum satisfaction. Because if you get too involved with your own ego that मुझे ये चाहिए, मुझे ये करना है, somehow your life will still be unfulfilled at the end of it. But the more you do for others, that's when the world also rewards you because you're adding value in your words, and that's where you feel valuable, so you feel nourished, and at the end of that journey you feel that okay, theek hai, this was worthwhile, whatever happened in the last like in this journey of my life, like it was worthwhile. So I think you are like actually incorporating that belief not just in your entrepreneurial journey but also in your life, because even right now through this platform or the platform that you are active on, LinkedIn, Instagram, everywhere, your intention is to just actually help people to see this is what happened to me and this is what could happen to you. So just take the right preventive measures, whether in health or in your life. Just like it's beautiful, sir. Like I actually feel that people like you are the reason which are the reason why like humanity still is in that direction of like going forward. Because if there were people like you didn't exist, then everyone would be a little lost. Like people would still figure out, there would be no manual, but you are like a live manual of things that could go wrong. So thank you for your service. So like
No, I
honestly.
think the way you answered that, right? For me, what is a good day? Getting one genuine thank you. And you just said thank you. So today is a great day for me.
It'll make it even
So,
better.
so for me, if somebody says thank you,
Yeah.
that for me is a good day. So today I'm looking at Life 2.0, as I call it, where I will always be an entrepreneur and a healthcare professional at heart. So that will still be 50% of my time looking at healthcare, looking at entrepreneurship in some form or the other. The other 50% is looking at my other interests in life. We spoke a little bit about my interest in cooking and music. I'm a travel photographer. I've taken part in a few photography exhibitions. I'm writing and producing a few songs. So that's the other hand. Sports enthusiast. I'm learning how to play golf. And I went back about 3 years to start this journey of wanting to share my story because I believe I made a lot of mistakes. And I wanted to share my mistakes with people so that people don't need to make the same mistakes themselves and they can learn from my mistakes. So my objective today is to take this journey forward. We built a good team internally now who's helping me take my journey forward. And the idea is again to talk about my experiences as a healthcare professional, as an entrepreneur, uh, as a leader, and what can that help the whole entrepreneurship ecosystem in India that is evolving. And I'm always happy to, step in and be a sounding board for anybody who needs my help.
Thank you so much, sir, for coming on the squeeze session with Galgal, sharing your insightful journey and so many life lessons that we are going to take forward for our venture. And not only that, the audience, please, look up sir on his social media, check him out. He's sharing real life examples of what he's been through. Thank you so much.
No, thank you guys for squeezing me in into your schedule. I enjoyed this conversation a lot, and you and I have been planning to hang out a little bit more.
Yeah.
But thank you for inviting me to be a part of this. It's a great honor and a privilege. Thank you guys.
Thank you, sir. Thank you so much.
Thank you.